If you're pregnant or thinking about it, there's one muscle group that's going to directly affect your pregnancy, your labor, your recovery, and your long-term quality of life. And almost nobody tells you about it. It's your pelvic floor. In this video, I'll go over what your pelvic floor is, what it does, and why it matters so much during pregnancy, and some tips to help your pelvic floor starting today. So here's a quick anatomy lesson. Your pelvic floor is a group of muscles that sit at the base of your pelvis, attaching to your pubic bone in the front, your sit bones on the sides, and your tailbone in the back. Right now, they're carrying the weight of a growing baby, and soon they're going to play a starring role in your birth. Your pelvic floor has 5 jobs. Here's a quick overview. Number 1, it supports your organs. It literally is holding everything up. Number 2, sexual function. It's involved in arousal, orgasm, and impacts your comfort during sex. 3, it's a sphincter. These muscles help hold in pee, poop, and gas until you decide it's time to release it. And during pregnancy, your pelvic floor needs to relax, lengthen, and open to allow your baby to pass through as well. 4, and this one's underrated, it acts like a sump pump. The muscle's pumping action moves blood and lymph up out of your pelvis. Without that, you'd feel swollen and uncomfortable, especially during pregnancy when you have more fluid and blood volume in your body. And 5, it's part of your core. It works as a team with your diaphragm, your deep abdominals, and your low back muscles to stabilize your whole trunk. So you can see how your pelvic floor greatly affects your quality of life. It impacts literally everything. Now let's talk about why your pelvic floor matters so much during your pregnancy and birth. Pregnancy, labor, and birth are the most transformative physical events your pelvic floor will ever go through, and we don't emphasize this enough. Your birth affects your pelvic floor, and your pelvic floor affects your birth. Your pregnancy puts extra strain and workload on your pelvic floor because of the increased blood volume, weight, laxity in your joints and connective tissues, your shifting center of gravity, and the physical stretching and expansion of your belly. Regardless of how you welcome your baby into the world, whether that's vaginally or via C-section, your body has still carried a baby for 9 months, and your labor and birth will have a lasting impact on how your pelvic floor functions going forward. And pelvic floor issues can not only cause discomfort and pain during pregnancy, but they can make your birth more difficult and make postpartum recovery more challenging. How you prepare your pelvic floor physically and mentally can make a real difference, not just in your labor and birth, but in your pelvic health for years afterward. During pregnancy and postpartum, here's what to watch out for. Leaking urine, especially with coughing, sneezing, laughing, or jumping. A heavy, pressury, or bulging feeling in your vagina or rectum. Pain in your low back, your hips, your pubic bone, your lower abdomen, your groin, or your tailbone. Pain with sex or pain in your pelvic floor at all. Straining to pee or poop or constipation. And I can't emphasize this enough. None of these are just part of pregnancy or things that you just have to deal with. Because people may commonly experience these things, it doesn't mean that they're normal or to be expected. They're all things that a pelvic floor physical therapist can help you with before and after birth. And this is exactly why I recommend seeing an experienced pelvic floor physical therapist before you give birth, not just after. Expert birth prep can make a huge difference in your pregnancy, your birth, and your postpartum experience. A knowledgeable pelvic physical therapist can identify and help you address any tightness or weakness in your body and muscles ahead of time, teach you proper pushing techniques, and help you prepare for physical and mental demands of labor. And on the other side, when you're postpartum, is where we help you reconnect to your core, support your recovery, and get you back to the activities that you love safely. So here are 3 habits that you can do to support your pelvic floor right now that are especially important during pregnancy. 1, practice breathing and relaxing your pelvic floor every hour. Set a reminder if that helps. Take a few slow breaths and try to feel your pelvic floor relax when you inhale. Number two, stay balanced. It's common to stand with your weight shifted onto one hip or to always cross your legs the same way, especially as your body changes shape. Try not to cross your legs or stand asymmetrically so you're not creating an imbalance through your pelvis. A balanced pelvis can help your birth be smoother. Three, ditch the heels. Wearing flats or barefoot style shoes as much as possible helps your pelvis in a more keep it in a more natural and neutral position and reduces unnecessary tension through your pelvic floor. Tension in your pelvic floor muscles can work against your baby's ability to rotate and descend down the body through labor and can potentially contribute to more tearing during pushing. If you want an expert guided plan for all of this, how to prepare your body, your pelvic floor, and your mind for birth, join me in Progressive Pregnancy. It's my online program with monthly group coaching and guidance for every stage of your pregnancy, so you can feel confident and prepared going into your birth. Head to progressivepregnancy.com to get started. And if you're in the Atlanta area, you can also see me and my team in person at Renew Pelvic Health. We offer fully customized one-on-one visits when you're trying to conceive or anytime in your pregnancy or postpartum journey. We also offer a pregnancy to postpartum optimization package that combines in-person care with progressive pregnancy. Go to renewpelvichealth.com for more info, and we'll include all the links below. If this was helpful, hit like and follow for more pregnancy and pelvic health content. You've got this.